What to do if you think you have COVID-19. In normal times, when the air does not hang heavy with a near-apocalyptic level of dread, waking up with a little tickle in the back of your throat is often resolved with a cup of tea and a cough drop. But these are not normal times, and even the most unflappable are susceptible to the concern that minor cold symptoms might mean an infection with COVID-19. COVID-19 is thought to be spreading widely in communities nationwide, but with very limited testing capacity in most areas, it's unclear just how much of the virus is in circulation. The good news is that many of these infections are relatively mild and even asymptomatic, so if you are infected, there's a good chance you'll be just fine. Here's what to do if you think you personally have COVID-19. What does COVID-19 feel like? The most common early symptoms of COVID-19 infection are fever and cough. About a quarter of adult patients have a cough and/or fatigue, and some have digestive tract symptoms like nausea, abdominal pain, vomiting, or diarrhea. Lots of other infections can cause these same symptoms. There are many similarities between COVID-19 symptoms and those of the flu, other cold viruses, and even some cases of strep throat. The difference is that this particular virus is new to people's immune systems, and that may explain why so many people who are infected with it have a more severe form of the infection that can lead to death. Signs of severe illness include shortness of breath, confusion, chest pressure or tightness, dehydration, and bluish lips. These symptoms are big red flags. If you have any of them, call your doctor or urgent care or emergency room immediately. Younger people can definitely get this severe form of infection. A review of recent data suggested that of 121 Americans with COVID-19 admitted to an intensive unit, the part of the hospital reserved for the hospital's sickest patients, many of whom need ventilator machines to breathe, half were between the ages of 20 and 64. However, people older than 60, especially if they have chronic medical conditions like diabetes, high blood pressure, and heart disease, are at highest risk for severe infections and death from COVID-19 infection. What do I do if I think I might have it? If you're home with mild illness, do what makes you feel better, and try to stay hydrated. That means drinking enough fluids with a little salt and sugar in them to urinate at least every 6 hours. If you have an appetite, eat, and get lots of rest and sleep. One of the most important things you can do if you're home sick with a not terrible case of possible COVID-19 is to stay home as best you can, and keep a wide berth of any others in your home. What can you do at home to feel better? Stay in your own room, if you have one, and try to stay at least 6 feet away from other people. Try not to share dishes or utensils, and if you can open a window to improve air circulation in shared rooms, do. If you can get a surgical mask, wear one to help reduce the spread of your germs if you are going to be around other people. Again, you only need a mask if you are sick. And wash your hands a lot, before or after touching common surfaces, and especially before and after preparing food and going to the bathroom. After a week, if you've been fever-free, without medicine, for at least 72 hours and your other symptoms have improved, you can leave home if you must. But until then, as best you can, stay in.